All right. Welcome back to the 21st Century Man podcast, everybody. Now, if you're someone who's ever, glanced in the mirror and thought, maybe things are looking a little thin up top, this deep dive is for you.
Yeah.
We are going chapter by chapter through this book, The 21st Century Man. And today we're focusing on a topic that I think is on the minds of a lot of guys out there.
Sure.
Restoring the hair on your head. And we are in chapter 56, which is conveniently titled, Restoring the Hair on Your Head.
That's right.
So consider this like your cheat sheet to understanding what this chapter has to say about male pattern hair loss and what you can do about it.
Absolutely. And this chapter is really special because it was written by Dr. Miguel Canales, who's a robotic hair transplant surgeon. And he really tackles an issue that so many men deal with. The book even mentions like the whole Larry David, like being bald is cool.
Right.
But then immediately pivots to be like, yeah, but a lot of men, they want a full head of hair and they feel less confident when they lose it. Yeah. So that's what we're going to be talking about today, trying to understand the causes, the preventions, and the treatments.
I'm ready. Let's do it. So the chapter kind of starts by just laying out like just how common male pattern baldness is. And they actually give the medical term for it, which is androgenetic alopecia.
Oh, yeah, that's a mouthful.
It is. It sounds really intimidating.
Yeah.
But the key takeaway is it accounts for over 95% of hair loss in men.
Wow.
So really, it's the overwhelming majority.
That's a huge number.
Yeah. And then the chapter points out that by the time you're 35, like 2 out of every 3 American men will have noticed some thinning. And by age 50, that number jumps to 85%. But here's a really interesting stat. Nearly 25% of men start experiencing this before they even turn 21.
Oh, wow.
So if you are someone who's in that group, the book really understands that you might feel prematurely older. This chapter's for you.
Yeah, and it's interesting because it shows this isn't just an old man's problem. You know, it can affect guys of all ages.
Right.
And I think a lot of times it's more than just like a cosmetic thing. It really affects how men feel about themselves.
Yeah, for sure. I think it really can.
So yeah, I mean, understanding why it happens and how to treat it can really make a big difference.
Absolutely. And this chapter really breaks that all down. So the number one cause, according to the chapter, is genetics. Now, they do say other things can cause hair loss, certain illnesses, medications, sometimes really bad stress. But for the most part, if you're experiencing male pattern baldness, it comes down to your genes.
Yeah.
And inheriting hair follicles that are sensitive to a hormone called dihydrotestosterone, also known as DHT.
Yeah, so DHT is like the main villain in this story. So what is DHT and what does it do to our hair?
Right, yeah, that's the question.
So DHT is basically like testosterone, but it's been modified a bit. So your body converts regular testosterone to DHT with this enzyme called type 2 5-alpha reductase, which is found in the oil glands of your hair follicles. So this enzyme kind of acts like an activator. It transforms your testosterone into DHT, which is the one that actually causes your hair to thin. So the exact genetic reason for this is still being researched. But what we do know, what this chapter emphasizes, is that DHT is the main reason why your hair follicles shrink. So as these follicles shrink, they start producing thinner hairs, shorter hairs, and then eventually they just give up. They stop producing hair that you can even see.
Wow, so it's like an ongoing exposure to DHT that wears down the follicles.
Exactly.
And they just can't keep up.
Yeah.
But the book says if you can reduce the effects of DHT, those hair follicles can keep producing hair.
Yes, exactly. And I think that's really encouraging because it means that there's hope.
Right.
It's not like a death sentence for your hair if you can catch it early enough and start addressing the DHT issue.
Right. So it's all about early intervention. And if you are starting to notice some changes, like it's helpful to know what the typical pattern looks like. So the chapter describes how male pattern baldness usually starts with a receding hairline. You know, that classic M shape.
Oh, yeah, I've seen that.
And then thinning around the crown of your head. And they specifically say the temples and the front part of your scalp are the most sensitive to DHT.
It's like DHT goes right for the most visible spots.
Right, like it's targeting us, so mean. And then as that progresses, it can lead to even more baldness across the top of your scalp.
Right.
But then they point out that even in the later stages, you often see this band of hair remaining around the sides and the back of your head, like the classic horseshoe shape.
Yeah, that's the classic.
And this hair is different. It's resistant to the DHT.
Right, that's why it sticks around, even when the rest is gone.
And that's really important to understand because it's the basis for treatments like hair transplantation, which we're going to get to.
Yeah, that makes sense.
Okay, so let's say you're seeing these patterns, in the mirror. What should you do? What's your next step to actually get this diagnosed. So the chapter talks about how doctors diagnose male pattern baldness, and usually it involves like just looking at the pattern of your hair loss, taking a medical history, like asking if it runs in your family.
Makes sense.
Since genetics is such a big factor.
Right.
But they also really recommend getting a full evaluation from a specialist, like someone who focuses on hair loss.
Sure.
Because they really have the expertise to properly diagnose you.
Right.
And they'll often use this tool called a dermoscope, which is like a special magnifying device to really get a close-up look at your scalp and the hair follicles to see like how bad the thinning actually is.
So it's like a microscopic level examination of your scalp.
Exactly. So they can recommend the right treatment. Okay, so we've talked about how common it is, the fact that DHT is the main culprit. We talked about the typical pattern. We talked about how it's diagnosed. But now let's get to what I know a lot of you are interested in, the treatments.
Yeah, let's do it.
And in the 21st century, man, they present this as like a huge turning point. In medicine, they say for the first time, we can actually stop or slow down hair loss and even naturally restore lost hair through surgery.
Wow.
So they break it down into two main categories, medical prevention and surgical solutions.
Okay, so two main approaches, trying to stop it before it happens and then fixing it if it's already happened.
Exactly.
All right, I'm ready.
Okay, so the first medical treatment the chapter talks about is finasteride, which is often known as Propecia. And what's interesting is this whole backstory. So it was initially developed as Proscar to treat an enlarged prostate.
Oh, interesting.
And during clinical trials, they noticed this side effect, that people were growing hair. And they were like,
That's a good side effect.
Right, yeah, I'll take that one. So years later, they got FDA approval for androgenetic alopecia, which is male pattern baldness, at a 1 milligram dose, and the book highlights that Propecia was the first oral medication proven to effectively treat male pattern baldness.
So this was like a game changer for guys with hair loss.
Yeah, it was huge.
All right, so how does it work?
Right, so they mentioned that it inhibits something called type 2 5-alpha reductase, which sounds very technical. Can you break that down?
Yeah, so remember how we were talking about DHT being the bad guy? It shrinks the hair follicles?
Yes.
Well, type 2 5-alpha reductase is that enzyme, the activator, that helps convert testosterone into DHT.
Okay.
So finasteride blocks this enzyme. It stops it from working.
So it basically reduces the amount of DHT in your body.
So by taking finasteride every day, 1 milligram, you can lower DHT levels in your scalp by up to 60%.
Wow, that's significant.
It is, and that's why it's so effective.
Yeah.
Because it stops the DHT from shrinking those hair follicles. In fact, studies have shown that it can stop hair loss progression in 86% of men.
Wow.
And even more exciting, 65% of men experience hair regrowth.
Wow, that's a really high percentage. Now, I know there's always two sides to this coin, so the chapter does talk about side effects.
Right. Any medication can have potential side effects, and it's important to be aware of those.
And they mentioned, the big ones, a decrease in libido, erectile dysfunction.
Yeah, those are the ones that guys usually worry about the most.
Right.
But the good news is that in the studies, the occurrence of those side effects was actually quite low. It was between 1% and 5%.
Okay, that's pretty low.
Yeah, and usually these side effects are reversible once you stop taking the medication. The chapter also mentions that finasteride can affect PSA levels.
Okay.
Which is important for prostate cancer screening. So it's really important to talk to your doctor about all of this before you start taking finasteride.
Yeah, it's always good to consult your physician.
Yeah.
Before starting any new medication.
Absolutely.
So finasteride, the first one. The next one the chapter goes into is Minoxidil, which is commonly sold as Rogaine. And this one was actually the first drug to receive FDA approval.
Oh, wow. So even before finasteride?
Yeah, even before finasteride, for treating male pattern baldness.
Okay.
And unlike finasteride, the exact way minoxidil works isn't fully understood.
Right.
But the book says the prevailing theory is that it widens blood vessels in the scalp. So it improves blood flow to the hair follicles.
Okay.
It might also prolong the growth phase of the hair follicles and potentially even increase the size of the follicle itself.
So it's like giving your hair follicles a boost in multiple ways.
Exactly.
Yeah.
But they do say that the effectiveness can vary from person to person.
Right.
So they've seen response rates anywhere from under 50% to over 80% in different studies, and they think this might be due to just individual genetic differences.
That makes sense. Everybody's different.
And then the chapter highlights a really important point. If you stop using minoxidil, the positive effects you've experienced will likely go away.
So you got to keep using it.
Yeah, consistently. And this is something you can buy over the counter.
Yeah, you don't need a prescription for minoxidil. You can find it at most drugstores.
Yep, 2% and 5% concentrations. In topical solutions or forms, they say you need to apply it twice a day to the areas where you're losing hair.
Okay.
And originally, the FDA approved it for just the crown of the head, but now a lot of hair loss specialists recommend using it on all thinning areas, including the front, the hairline.
So it's kind of become like a general use hair loss treatment?
Exactly, yeah. And the key, they say, is consistency. You got to apply it regularly as directed, or you risk losing any progress and even shedding some hair.
So you don't want to be skipping days.
Right, you got to stick with it. Okay, and then they have this interesting section on a more recent development.
Okay, what's that?
Which is the use of low-dose oral minoxidil.
Oral minoxidil. I thought it was just topical.
Yeah, so this is like a newer thing that some dermatologists and hair loss specialists are exploring. The book says that very low doses, like 5 milligrams or less, have shown some promise in certain patients, especially people who get scalp irritation from the topical formulas.
That makes sense.
But it's important to remember that oral minoxidil is not FDA approved for hair loss treatment. So anyone considering this should definitely be under the care of a medical professional.
Absolutely.
And they need to really carefully monitor the dosage to avoid any potential side effects. The chapter also mentions that some doctors recommend combining oral finasteride with topical minoxidil because they can work in different ways to fight hair loss, and they might have a synergistic effect.
So it's like a 1-2 punch.
Yeah, exactly. So finasteride's tackling that DHT issue from the inside out, and minoxidil is stimulating those hair follicles on the scalp.
Got it.
Okay. And then they also talk about some newer treatments, like platelet-rich plasma, PRP.
Oh, yeah, I've heard of that.
Yeah, this one sounds kind of sci-fi.
It does. It sounds very high-tech.
So the idea behind PRP is that platelets in your blood are full of growth factors that can stimulate healing and tissue regeneration. So they take a sample of your blood, they use a centrifuge to concentrate those platelets, and then inject this super concentrated platelet-rich plasma into the areas where you're losing hair.
So they're basically injecting growth factors right into your scalp.
Exactly.
Interesting.
And the hope is that it'll stimulate those hair follicles, make them healthier, and maybe even promote new growth.
So what kind of results are we talking about here?
Yeah, so the book says that studies have shown it can reduce hair shedding.
Okay.
It can improve the thickness and texture of your existing hair, and potentially even lead to 10% to 15% more hair growth.
So modest regrowth.
Yeah, modest regrowth. And they mentioned Dr. Canales' practice. They recommend monthly treatments for about 4 months for people in the early stages of hair loss.
Oh.
But they do say those injections can be kind of painful.
Oh, yeah, needles in the scalp.
Doesn't sound fun. All right, and then the last sort of newer treatment they discuss is low-level light therapy, which is LLT. And I've seen these advertised. They're like laser caps or helmets.
Oh, yeah, you wear them on your head.
Yeah, that you can use at home. So they mentioned Theradome and Capillus as two examples that have received FDA clearance for hair growth. And again, they're not exactly sure how it works, but the idea is that the low-level light energy stimulates the hair follicles, encourages them to grow.
So it's like giving your hair a little light show.
Yeah, exactly.
To help it grow.
And they say you wear these caps for like 20 minutes, 2 or 3 times a week.
Yeah, something like that.
Not too bad. All right, so those are the medical and some of the newer treatments. Now let's talk about the surgical option, hair transplantation.
Right, and the book says this is really the only permanent way to restore hair to areas that have gone completely bald.
Oh, wow. So this is like the ultimate solution if you've lost your hair and you want it back. Exactly. And they say that modern hair transplant techniques can achieve really natural-looking results that are almost undetectable.
So it doesn't look like you've had a hair transplant.
Right. So the way it works is they take hair that naturally grows in these small groups called follicular units, which can contain anywhere from 1 to several hairs. And they carefully harvest each of these follicular units to become a graft.
So it's like they're transplanting tiny little bundles of hair.
Exactly. And the surgery itself is done in a single day and involves 3 main steps. First, harvesting those follicular unit grafts from a donor area, usually the back or sides of your head, and then creating tiny recipient sites in the balding areas where those grafts will go.
All right.
And then third, meticulously implanting the grafts into those recipient sites.
So it's a very precise procedure, very detailed.
Yeah, it's not just like, slap some hair on there. Very meticulous.
So where do they get the hair for the transplant from?
Right. So it has to be hair that's going to keep growing. So they almost always take it from the back and sides of your head.
Okay. Because that hair is generally resistant to DHT, the hormone we were talking about earlier.
Right, the one that causes hair loss.
Exactly. So they're basically redistributing your own healthy DHT-resistant hair to the areas where you've lost it.
So it's like a strategic relocation of your hair.
Exactly. They do say these surgeries can take a while, 6 to 12 hours.
Wow.
And they can cost anywhere from $10,000 to $20,000 or more, depending on the extent of the transplant.
So it's a significant investment, both in terms of time and money.
Yeah, it's a big decision.
Yeah.
But the results can be pretty incredible. Okay, so now let's talk about the two main techniques they use for harvesting.
Okay.
Follicular unit transplantation, FUT, and follicular unit extraction, FUE.
All right, so those are the two main methods, FUT and FUE.
And they say both can be very effective in the right hands. So let's break it down.
All right, let's do it.
What are the main differences between those two approaches?
So with FUT, the surgeon removes a thin strip of skin for the back of your head,
where the hair is nice and thick. And then this strip is divided up under a microscope into individual follicular units by a team of technicians. And then the incision where they removed the strip is closed with sutures, which leaves a linear scar. Now, they do say that this scar is usually covered by your hair if it's long enough, but if you have really short hair, it might be visible.
Okay, that makes sense. So that's FUT. Now, what about FUE?
So FUE is a little different. Instead of removing a strip of skin, the surgeon uses a tiny punch tool. It's less than 1 millimeter in diameter.
Wow, that's tiny.
Yeah, it is. To extract each individual follicular unit from the scalp.
Okay.
And for this procedure, the back of your head needs to be shaved so the surgeon can see what they're doing.
Okay.
And then once all the grafts are removed, you're left with thousands of tiny little dots where they took the hair from.
Okay.
And the good thing about FUE is that these dots heal naturally without stitches, so the scarring is minimal.
So it's less invasive overall.
Exactly. It's less invasive and the scarring is less noticeable.
Okay. And then they also talk about some of the technology that's used to assist with FUE, like the RTS robotic system.
Oh, wow. Robots doing hair transplant.
Meograft, SmartGraft. And they say, these are cool tools, but it's really still about the skill of the surgeon.
Right. The robots aren't doing the surgery themselves.
Yeah, they're just assisting. So ultimately, whether you choose FUT or FUE, the success really depends on the experience and expertise of the surgeon.
That makes sense.
So it's really important to find a qualified surgeon, no matter which technique you choose.
Absolutely.
Okay, so once the follicles have been harvested, what happens next in the transplantation process?
So the next step is creating those recipient sites, the tiny incisions in the balding areas, where they're going to implant the grafts. And the surgeon uses very fine blades or needles to make these incisions. And the angle, the density, the pattern of these sites is really important. It determines how natural the hair will look.
So that's where the art comes in.
Exactly. It's not just a science, it's an art. And then once the recipient sites are created, each graft is carefully inserted into these sites. And they use this analogy in the book. It's like planting seeds in the ground.
Okay.
So once they're implanted, the new follicles will take root in about 7 days. Then the transplanted hair will enter a dormant phase called telogen, which lasts about 4 months. And you'll start seeing new hair growth at around 6 months after the surgery. And then the final results usually take about 12 months.
Wow. So it's a process. It takes time.
It is a process. It's not an instant fix.
Right. You got to be patient. But the results can be worth it.
Absolutely.
And then finally, the chapter ends with this really valuable advice on how to choose a hair transplant surgeon.
Okay. Yeah, that's important.
Because it's a big decision. So what do they recommend?
So they say ask potential surgeons about their experience, how many transplants they do each year, their training, their qualifications, what to expect on the day of the surgery, the different techniques they offer, and which one they think is best for you. And I think this is really important. Ask to see before and after photos.
Oh, yeah, definitely. Of patients who had similar hair loss to you, absolutely. You want to see their work.
Right.
Exactly.
They also recommend asking about how they handle dissatisfaction if you're not happy with the results.
Yeah, that's a good question.
Whether you'll need to keep taking medications like Finasteride or Minoxidil after the transplant, how they track your progress and results, and what their post-op care is like.
So it's really about finding a surgeon that you trust.
Exactly. You want to feel comfortable with the person who's doing your surgery. It's a big decision.
Right. And the book emphasizes that the most experienced clinics typically do a lot of cases each month, like more than 10. They have a full-time team of technicians, and they offer a variety of different approaches.
So you have options. You're not limited to just one technique.
Exactly. Okay, so let's recap what we learned in this deep dive. Into Chapter 56 of The 21st Century Man,
Okay.
you now have a much better understanding of male pattern hair loss, the main cause being DHT sensitivity, and all the different medical and surgical treatments available. As outlined by Dr. Canales, this book is a great resource.
Yeah, this chapter was packed with information. We covered a lot of ground today.
So we talked about the preventative medications, like finasteride and minoxidil. We talked about the hair transplantation options, FUT and FUE. We discussed the newer options like PRP and low-level light therapy. And we even got into the nitty-gritty of how to choose a surgeon. So we really encourage you to go and read Chapter 56 in its entirety to get the full picture.
Absolutely. There's so much valuable information in there. It's worth reading the whole chapter.
And think about this, with all this knowledge. Hair loss doesn't have to be something that you just passively experience.
Right. You have options. You can take control.
This chapter empowers you to explore solutions and make informed decisions about what's best for you.
Exactly. It's all about taking charge of your own hair journey.
What stood out to you as the most promising option? What other questions does this bring up for you?
It's definitely a lot to think about, but it's great to know that there are so many possibilities.
Absolutely, and we hope this deep dive has been helpful for you. Join us next time on the 21st Century Man podcast as we delve into another chapter of this book, Chapter 57, Plastic Surgery for Men.
Ooh, that sounds interesting. I'm looking forward to that one.